So I'm going to try to do this in 15 minutes to summarize some of the lessons that we've learned and lots of questions as well from the seminar. So this started in the agency, not when Santé Publique France is today. This started in 2018 and 2019. We started with a workshop in 2019 with Santé Publique France, and the CCNE took part as well with a public health focus at the centre of our discussions, and then we had a consultation and internal investigation with agents to prepare the benchmark document. Martine Benjnar, I'm very happy for her to be here. She was president of the CD. She was very active and involved in all of this as well, and we are very grateful for that. So I still feel like I'm talking like the former director, but I should be careful the words I use. But in this context, there is a very important point, which is the CCNE's opinion 137 in October. We didn't see that coming. We had a lot of questions, and we thought this is great. The opinion, it really insists on participation as well. It isn't easy in an agency like Santé Publique France, probably in others as well. So this was a benchmark really that pushed us to say that we have some elements as well. We could interact and work with them, and this contributed to implementing this seminar really and organizing it. And then to also be committed to finding these benchmarks, and this started when we started organizing this seminar, and this all converged into one project. And then at the center of all of this, you have the questions raised by the pandemic. We'd started talking about this before, but it was a very significant element, like we've already said. So how to not forget the lessons or the elements that we have had to face, and to draw lessons from this. Next question. So the purpose of this is to strengthen integration of ethics in public health in the implementation of missions. It's very operational, programs and projects in the agency, so across all levels, mission, program, projects. You want, in terms of objectives, you want to find a area for expression, sharing and reflection on ethical issues based on experience and practice, whether that's national or regional level. We also want to put this reflection into perspective to implement ethical questioning. We can do this through a process with the implementation in practice to share our thoughts as well, namely with the actors already working on ethics, CCNE, and then to contribute to work on public health ethics, in particular with the CCNE. Like we've already said, this isn't an end in itself, it's a milestone to be able to have elements to build up the next steps. And we wanted to have this collective sharing of experiences so that we can guide ourselves in the future. So we started with a framework document, which we discussed in the different bodies, DG, CD, COD. We divided into 3 thematic workshops and a summary seminar. For each one, we've written a lot. We have hundreds of pages from each one of these events, all of these pages and information that will be interesting to understand the methodology as well. All of this will be presented, and then a consultation with experts from outside Santé Publique France. We are just one element among others. We are a governmental agency, and so how are other partners doing that we work with who aren't always necessarily in line with the visions? They may have different values, so that was a very important point as well. We had 45 interviews with Marc Karim, who will be presenting that. And then the last but not least, an internal survey with qualitative interviews. We were lucky to have a master's as well in social sciences. I was lecturing, so Clarisse will actually be presenting that to me as well, and a lot of lessons that have been learnt. We have documented all of this, we have transcribed, and we will send the workshop participants their texts so that they can see everything that has been done. In terms of how the workshops work, we've already said this with Anne-Catherine this morning, but the first workshop was more generic, a bit more cross-cutting, whilst trying to insist on the specificities of ethics in a public health agency, which is help for decision making, but doesn't make decisions directly. We therefore thought that was interesting. When you read a lot of texts and papers, it always references decision makers and not this idea of what Lisa really insisted on. Workshops 2 and 3 were on field subjects. So we have mobilized a lot of our colleagues who had experienced these kinds of issues, had been facing these questions, not necessarily ethics, but to work with them to build these workshops based on field experience with case studies that moved away from practice a bit as well, which is very important. So not just for the on-the-field investigations, but also the questions raised by uncertainty. Not everyone has these same questions, and even less decision makers. So the ethical dimensions of participation is a very important topic as well for Santé publique France specifically. So there may be some elements or different thinking processes that can be contradictory, but we can't do without them when we are working on this participation. Then prevention and promotion of health. This is something else. Social inequality, social justice, and then communications issues as well, which were very important as well in terms of sharing that. So questions that were raised from data and communication, which aren't always taken into account from an ethical perspective. So who contributed to this? Everybody played their role because it's important to have this different dimension. So we had project leads, program managers from most departments as well. We also had questions based on practice in their organization. We looked at case studies as well, which was really enriching work. I thought this was the most interesting part. And then a ramping up of interest and participation with the progress of workshops. So this was really positive at our level. Anyway, and then the CED contributed as well. It was very well-meaning and provided its opinion on the theoretical part as well, and contributed to the speakers and the content, and provided a lot of support on the benchmark document, which Martin-Laurence will present this afternoon. And then the COD, the Orientation and Dialogue Committee, provided elements that we hadn't necessarily thought of, which we will talk about as well. Long time, common, so the greater good, citizen participation, transparency. Other agencies, which we would like to thank as well, took part. So this basically created this collective which goes beyond the agency itself, and then the CCNE as well, we've already said that, has also contributed to the workshop. Laurent's participation was very important as well. We've tried to combine the concepts, practices, and case studies. We tried to make sure that we weren't only looking at concepts, but also putting this in a practical view as well. The CED was very essential on this point as well. We needed to have these different elements, and then in practice, it's just daily practice, really. So each session introduced a topic from either an ethical or a philosophical or practical standpoint. So this put the case studies into perspective. They were presented by those who encountered them in the different fields of action. They were situated in their context with the team, working on their topics in a territorial context, or even a very local context, because this is epidemic in institutions as well. Something that we hadn't necessarily imagined as well, which was we had to provide support for the case study leaders, because it wasn't natural for them necessarily to come and talk about that. So I've put this quote here, which summarizes: if it's one thing to identify issues that we perceive may touch on ethics in public health, so some uncertainty, that's one thing. It's quite another to come and talk about them in a collective workshop where we're talking about ethics, because that's what we do at these workshops. We talk about ethics. And that's another thing. So some people said it's interesting, but it's not for me. And maybe then they came back and they thought, actually, on second thought, I may have some things to say. So this was an opportunity as well. So we can really see that through this process, the participant has a place to talk about this and to share. This was really a preparation work as well that was very significant and which was out of the ordinary for them. Next question. So significant interest and engagement, a lot of curiosity as well. People were very curious. It was very stimulating as well. Some people really enjoyed preparing these materials as well. A couple of people said that to me. Whereas the topic is perceived as being complex, and you may feel alone when dealing with those topics. We don't necessarily have support. It also reveals that these ethical questions arising from practice were little or not addressed in a reflexive manner, even if they were more or less noticed. Some approaches had been started in some entities, but to be able to work on this and assess different visions in other entities, that was a very important aspect as well. The deliberative, reflective approach that allows us to take time to talk about this, and time is money, so to put some time into this and accept that it's something important that you need to work on. You need this institutional commitment as well with support, and we had that. And this also, which wasn't the goal, we didn't ask for feedback on the experience, but some people came back and said that it was really interesting, and there was some resilience as well. With people realizing that there were some things they could have done a little bit differently with ethical perspective as well. So the diversity of these issues and context depends on the scope of missions in a public health agency, like in the CDC or other institutions as well. But this also has a regional presence as well across all regions, and this affects very heterogeneous, varied regions. So there is, in italics, here you have a few words here that came up: field investigation, production of data and indicators, clusters. That's a very significant issue as well for a few of us. And how can you integrate this ethical idea in participation in construction, social inequalities, prevention, intervention, citizen participation as well, which, like I said, is very important. Next slide, please. Therefore, this creates expectations for the next work. There was good participation, but that's just the tip of the iceberg. So what's the representativity like? What about the people who didn't feel comfortable participating as well? I think that's a very important point for the future. This also reveals some needs and expectations as well. There is a reference framework or guide, internal discussion fora as well. We need to discuss that. We need to organize that. And this sends to hierarchy as well to give some room for maneuver. The role of the CED, external opinions. And then we've already said this, but maybe have external opinions or maybe not. I mean, these are all questions that we have to face. Support and resources for implementation, training is vital. We have spoken about that as well. Lisa mentioned it. And then constraints and levers for the agents in their work. What are these constraints and levers? And should this be formalized? Should we have to have an ethical question part of a project? So this was really brought up as well as being, you know, compulsory to justify the number of subjects that you need, for example. I may be pushing this a little bit far, but those are the things that come up. And then shared analysis, integrated analysis to not feel alone, and then how we can reconcile an agency's missions, some of which are urgent, with the ethical issues that require time for shared reflection, which a few people have mentioned today, and how to integrate all of that. So we can't just say, we'll tell you what to do in 2 or 3 days. We're thinking from an ethical perspective how preparation is important. And the last slide, I think, as a conclusion, the milestone seminar. The word milestone really is the watchword here. And this was designed specifically. So before we commit, you know, people were saying, when you've done your seminar, what happens then? So we wanted to use the word milestone because it's not an end in itself. In terms of Santé publique France management, we have different perspectives which give us which allow us to take stock of what is happening with these issues and needs in the agency. See what happens elsewhere with diversity and things that exist in other places, to know in these perspectives, whereas there is experience and definitely things that need to be valued and used, and this is part of a broader need for public health in terms of practices, research, training and teaching. Thank you very much.